And anything new on the contact tracing efforts for the QCPD cops who were deployed despite testing?
It should be the local government unit of Quezon City who must conduct the contact tracing in relation to those Quezon City police who tested positive with COVID-19 during the even after they were deployed during the SONA. And the DOH is also calling on all individuals who attended the gatherings during the SONA and reminded them to coordinate with their local government units if they think they had an exposure with any of the policemen deployed on the ground that day. Sean?
All right, I'm going to switch topics on you here, Greg. President Duterte has already said to go ahead and vaccinate those from other sectors that are willing instead of waiting from those coming from the A2 and A3 sectors to finish their vaccinations. Who would be eligible to receive these vaccines should members of the priority sectors A2 and A3 refuse their vaccinations?
And still those individuals who qualify from the A1 to A5 priority sector, meaning if those individuals from A2 and A3 will not go or will not get their vaccines, A4 and A5 may receive these vaccines, but we should also factor in the availability of vaccine doses, especially which could be used to which priority sector. In particular, if we're going to use vaccines from COVAX facility, this cannot be used for essential workers, but it may be used to indigent population. Sean?
That's right. Not all vaccines will be given to all sectors. Now, was there any reaction from the DOH regarding Octa Research Group's recommendation to shorten the interval between doses of Sinovac, the 2 doses of Sinovac?
The department is open to any recommendations. This particular recommendation of shortened dosing interval for Sinovac and AstraZeneca still has to be discussed and studied with the vaccine experts panel, because according to Vergere, the current dosing interval that we are using with our vaccines are based on the study or the data which these vaccine manufacturers generated from their clinical trials, where their dosing intervals provide highest efficacy. Shorten the interval for the doses of Sinovac, we may not be able to get the same efficacy that they are giving right now. It would give a much lower efficacy for those individuals who will get 2 doses of Sinovac with only 2 weeks interval, because according as Dr. Gloriani emphasized, the longer the interval between 2 doses, the higher the efficacy it provides. Sean?
Right, that echoes pretty much a statement of Dr. Solante, who also belongs to the vaccine expert panel. Thank you so much, Greg Gregorio, for that update, reporting to us live from Mandaluyong.